Welcome to the prostate cancer part 20, androgen synthesis inhibitors. We'll speak about the ketoconazole. This medication is not FDA approved for treatment of prostate cancer and it is not commonly used anymore. Mechanism of action: ketoconazole is competitive inhibitor for several cytochrome B450 enzymes. That includes 11p hydroxylase and CYP17, a complex that contains 17 and A hydroxylase and C17 and 20 lyase. Inhibition of CYP17 to reduce synthesis of androgen in the adrenal gland and the testes. Inhibition of 11p hydroxylase reduce synthesis of aldosterone and glucocorticoid in the adrenal gland. Thus, mineralocorticoid and glucocorticoid replacement is recommended when using ketoconazole. This is a very nice diagram to show you the action of the ketoconazole. As you see, it's work on CYP11A and CYP17A1 and also CYP17 as you see, and also so it's work on the gland and the testes. So on the testes, as you see here, it's block the CYP17, which is actually is also 17A, which is precursors of which is enzyme important for conversion of the precursors of testosterone that's produced by the testes. So conversion of precursor to DHEA or dihydroepiandrosterone, which is actually increase the cell aggressiveness and increase the cancer cell. So block it to this, which is actually inhibit a production of testosterone. Another way that's here ketoconazole block this on the gland DHEAS, also by blocking CYP that cortisol to confirming from conversion to pregabalin and also progesterone to convert to 17 alpha hydroxyprogesterone, which is in by androstenedione or androstenedione. So this is a blockage point for the ketoconazole. Castrate level of testosterone may occur by 8 hours after 400 milligram of oral dose. The effects are dose dependent. Testosterone is diminished with 800 milligram per day and eliminated with 1,600 milligram per day. The side effect: hepatotoxicity, weakness, lethargy, nausea, vomiting, and decreased libido. And also the dose limiting side effect like nausea and vomiting can occur. Adult dose: ketoconazole 400 milligram per oral TID, tabs of 200 with steroid, which is actually prevent develop of mineralocorticoid increase in the body and which is lead to adrenal insufficiency, which Addison crisis. So example, hydrocortisone 10 milligram per oral TID and prednisolone 5 milligram per oral BID. Side effect might be reduced by starting a small dose, 200 milligram per oral TID, and increasing the dose to reach 400 milligram TID as tolerated. Ketoconazole decrease warfarin metabolism, therefore it must be avoided in patients who have warfarin or check for an alternative. Avoid use of hypoglycemic agents. It will lead to severe hypoglycemia. Require stomach acids for dissolution and absorption. So very important to use, therefore give all gastric acid blockers 2 hours after ketoconazole dose because it will lead to the required acid for dissolution and absorption. Okay, so leave the acids to help the ketoconazole to dissolve and also to absorb it by the stomach. So therefore, give all gastric acids blockers 2 hours after ketoconazole dose. We'll come to Ebratron. Ebratron, it's FDA approved, not like ketoconazole, which is not FDA approved. So Ebratron is FDA approved for use with castration for the treatment of metastatic high-risk castration-sensitive prostate cancer. So metastatic castration resistance prostate cancer. So this is a two indication for Ebratrons to be used for management or for patients with castration for treatment of metastatic high risk castration sensitive prostate cancer or metastatic castration resistant prostate cancer. So high risk is defined as one of studies as at least two of the following criteria. That's Gleason score more than 8 or visceral metastasis or more than or equals 3 bone metastasis. This is a high risk criteria. Okay, so this two of these criteria indicate that it's high risk cancer. Mechanism of action. Abratron is a selective irreversible, unlike ketoconazole, which is reversible. It's irreversible inhibitor of CYP17 cytochrome B450 enzyme complex that contain C17, 20 lyase, and 17 alpha hydroxylase. CYP17 is required for androgen synthesis and is present in testes, adrenal gland, prostate, and other tissues like skin. By inhibiting CYP17, Ebratron reduces androgen production. In the adrenal gland, inhibiting CYP17 reduces the synthesis of androgen and glucocorticoid, but it increases the synthesis of mineralocorticoid. Thus, Ebratron can cause glucocorticoid insufficiency and mineralocorticoid excess. Asteroid is administered with Ebratron to prevent glucocorticoid insufficiency. Note that Ebratron and ketoconazole both inhibit CYP17. However, they differ in the following ways. Ebratron is selective inhibitor of CYP17, while ketoconazole is a non-selective inhibitor for several cytochrome complex, including CYP17 and 11B hydroxylase. Ebratron is potent inhibitors of CYP17, where ketoconazole is weak inhibitors of CYP17. Ebratron is an irreversible inhibitor, but where the ketoconazole is a reversible competitive inhibitors. Ebratron increases aldosterone because it inhibits only CYP17. While ketoconazole decreases aldosterone because it also inhibits 11B hydroxylase. Blocking androgen can be produced within prostate cancer cell. So the intra-tumor androgen stimulates prostate cancer growth, even when circulating extra-tumor androgen are minimal. So Ebratron reduces both intratumor testosterone and circulating extratumor testosterone. Dose for US brand Zytiga Ebratron 1000 mg per oral per day on an empty stomach, remember. So tabs of 250, 500 mg with oral prednisolone. Okay. This is Zytiga 500 mg. So we'll use 1000. And this is the mechanism of action of Ebratron. As you see, it works on CYP17, the adrenal gland and also in the testes. The dose of Ibratron does not need to be adjusted for renal dysfunction, but remember, it might need to be adjusted for liver dysfunction. So for castration-sensitive disease, administer prednisolone 5 mg per oral daily. For castration-resistance disease, administer prednisolone 5 mg per oral BID. So for those who are sensitive, we will give prednisolone 5 mg. That's those castration sensitive. The castration resistance, also we give that's the prednisolone, but here it is BID, not once per day like insensitive. Taking Ibratron with food can increase its absorption and increase the risk of side effect. Therefore, the Zytiga should be taken on empty stomach at least 1 to 2 hours, 1 hours before eating and 2 hours after the meal. A randomized phase 2 trial showed that 250 milligram per oral per day after low fat breakfast was non-inferior to the standard dose, which is known actually 1000 milligram per oral query per day after overnight fast. Also, the lower dose is not FDA approved. It is less expensive. If side effects are problematic at a lower dose, food can increase absorption in unpredictable manner. Then try switching to standard dose 1000 milligram on empty stomach. Dose for US brand Yonsa. This is fine particle formulation of Ibratron. This is Yonsa, it's 125 milligram. So it is important to realize that the dose per tablet and the administered dose are different from the original Ibratron formulation, US brand name Zytiga. The dose is Yonsa 500 milligram per oral query per day or TAPS 125 with methylprednisolone 4 milligram per oral BID. Yonsa might be taken with or without food. Before starting therapy, check the blood pressure and check serum potassium and liver function test. Control hypertension, correct hypokalemia before starting Ibratron. Be cautious administering Ibratron in patients with medical conditions that can be exacerbated by the side effect. Example, heart failure, cardiac arrhythmia, liver dysfunction. During therapy, monitor blood pressure, serum potassium, serum phosphate, liver function, fluid retention, sign of adrenal insufficiency. And also the sign of usually every 2 weeks for initial 3 months after starting the therapy, then every month thereafter. So every 2 weeks for initial 3 months, then every month. This is the action of Ibratron, as you see here. It's block progesterone from confirming to the pregabalin and also from confirming to the testosterone. This is the action. Androgen synthesis inhibitors. This is cautions for patient using the Ibratron. Cardiovascular problem is also important to evaluate for arrhythmia and heart failure by checking ECG and also cardiac biomarkers is echo and monitor all this blood pressure and so on. Efficacy. In metastatic castration-sensitive prostate cancer, Epratron improved overall survival and progression compared to placebo. In men with metastatic CRPC previously treated with docetaxel or not, Epratron improved overall survival by 4 to 5 months and delay progression compared to placebo. Side effect, hyperaldosteronism, mineralocorticoid excess, that's fluid retention or edema, 27%, hypokalemia, 28%, hypertension, 9%, alkalosis. This is the side effect. Other common side effect, fatigue, the musculoskeletal pain, nausea, vomiting, hot flush, diarrhea, cough, and headache. All this is common side effect for Epratron. Other less common side effect, liver dysfunction, severe in 6%, cardiac failure 2.6%, cardiac arrhythmia 4%. Men who failed ketoconazole have a higher failure rate with Epratron and vice versa. That's when one of this medication failed, the other medication should be avoided. Use Epratron in combination with radium-223 is not recommended because it results in higher rate of fracture and mortality. Okay, this is the end of this session. We'll meet again in another session of anti-androgen therapy.